general question of common strategic policy delivery. How did it work across the departments? And we will also ask about the risks and risk management, outcomes and impact for the people of Jersey. But before we'll go to the questions, let's do the introductions. Deputy Anna Gardiner, President of the Scrutiny Liaison Committee and Chair of the Common Strategic Policy Scrutiny Panel.
Deputy Helen Miles, Vice President of Scrutiny Liaison Committee and Chair of the Corporate Services Scrutiny Panel.
Deputy Louise Dublé, I'm Chair of the Health and Social Security Scrutiny Panel.
Deputy Catherine Curtis, I'm Chair of the Children, Education and Home Affairs Panel.
Deputy Alex Curtis, Member of the Environment, Housing and Infrastructure Scrutiny Panel.
Deputy Montfort Tadia, I'm Chair of the Economic International Affairs Scrutiny Panel.
Thank you. And Minister Fliss.
Deputy Lindsay Feltham, Minister for Social Security.
Deputy Rob Wall, Minister for Education and Lifelong Learning.
Keith Posner, Interim Chief Officer in SIPES.
Jonathan Williams, Programme Director for SIPES.
Sophie Laswell, Chief Officer for Employment, Social Security and Housing.
Suja Hamill, I'm Associate Director in the Cabinet Office.
Thank you. And I would start with a very simple question. We'll start with the Minister for Social Security. In what ways does your department's budget contribute directly to the delivery of the 13 common strategic policy priorities?
In relation to the, in relation to the budget, we've obviously got the reduction of GP fees, which is funded through the Health Insurance Fund. So that doesn't necessarily, because it comes through the HIF, appear in the budget and government plan documents that get debated. But that's something that is obviously within the budgets that Sophie is responsible for. Again, the transition to the living wage, we have the money from the Better Business Support Package, which again then gets put into the budget of the Minister for Sustainable Economic Development, and we have the Registered Employee Support Scheme money within our ESH budget. I'm just double checking that I'm not missing anything else based on, but I think at the end of the day, anything to do with affordability and maintaining enabling people to live on the island and help with the cost of living. So, for example, what we're doing in this budget this year in relation to the childcare provision, which is coming from that reduction in the state's grant. So that the work that we've done around the reduction in the state's grant to free up money so that they're available for other CSP priorities is, I think, a really important piece of work that I've been able to support other ministers with.
Okay, thank you, Minister.
So what was the question? It was a long answer.
What priorities from the Common Strategic Policy within your remit, and if any priorities are at risk for non-delivery due to the budgetary or resource constraint?
Well, I'm pleased to say that as long as the government plan is agreed and the money comes forward, that the three priorities that I have, which are, I'm pleased to say the first three, although they're not in that order, but as I've said before in other hearings, as Minister, you'd want them to be in that order, of course you would, but extending nursery and childcare provision, the money is budgeted for, and that's the right amount of money. I'm sure we'll get questions later.
Yeah.
The school meals are in place and the money's for there, and there is an increase in the provision. We've done a lot of work on lifelong learning and skills development with some of the things that we brought forward in terms of higher education funding and the funding in those areas, and the living wage support scheme as well. So there's things there. I've got to say that mine is more the delivery of things and spending the money, which is very pleasing to do, rather than providing the money from the funds, to be quite frank.
A question, as in terms of the delivery of the legislative program under your ministerial remit, what draft legislation will no longer be delivered in this term? Are there any legislation?
Not really. I don't think there are.
Can I ask about the review of the education law that was previously planned?
Yeah, the review of the education law, I think, is something for a new term because it's a huge piece of work and needs to start at the beginning. I've always taken the approach to say that what small parts of the education law can be changed that are obvious now, and I think any things that we want to do just involve small changes there, particularly higher education law. They've been quite simple to do. I think the education, but however, we are doing a lot of work around, which is not to do with the CSP, admittedly, around governing bodies and the relationships with schools and structure of schools, and that work needs to come through. And I think that would be like if I can say, a symbiotic relationship with the education law as we make those changes.
And how long would it take and how much would it cost to fully review the education law?
Good question. I'm not prepared for that because this is a CSP hearing, but I think in terms of time, I couldn't give an estimate on time or cost to reviewing the entire education law.
Are you able to start any of the work at the end of this term to prepare for the next term?
I think, what do you think we've started? We've undertaken some work around some areas and the budget, and the laws around, well, it would be around governing bodies, the work we're doing there, the work around, but that's more to do with the provision of higher education funding, which is a slightly different area.
We've also got SEM provision.
And the SEM provision, I presented to the Assembly the other day. We've been very open and transparent about that, and it may need some law changes. But I think we need to look at our structure and see what law changes are necessary and what we can do without those law changes. I think we can make change without law changes. However, what I would hope, and whoever's in this position in the next 4, 10, 12, 15 years, they doing the right thing in those terms will drive the right changes to law as well.
Okay. Increased provision of lifelong learning and skills development, and it's connecting to the education law. Was it any work done for increasing age for educational funding up to 18, 19 to ensure that everyone has a chance?
Yeah, that is something that we're working on. One of the things I would want to do, we are looking at actively at the moment, and the work is ongoing, whether it will be ready before the next election. Good question. Hopefully it will become an issue around it because I think it's so important, is to look at making apprenticeships a statutory requirement, statutory right, so that they are treated in a slightly different way. And I think in the changing world of qualifications, the changing world of provision and the changing world of need for our island, that is something we could certainly do. There is money. We've made changes to distance learning and access to distance learning, make it equitable to the funding for in-person learning, which I think is a good step forward.
No, but the question is, any changes to the education law for the statutory provision for education up to 18, 19 will be done during this term?
I'm not going to bring forward making the compulsory age to 18 in this term. I don't think we're in a position yet to make that meaningfully. I would rather do the work on what that means first.
Understand. Deputy.
Yeah, can I ask a cross-cutting question? And the other minister will be familiar with this line of questioning. Data shows us that there are around 21,000 islanders living in poverty, and 4,000 of those are children living in relative poverty. How have you worked together to tackle this? And indeed, have you worked with wider ministerial departments, and does this budget go far enough to tackle child poverty?
Well, there's two things here. One is in terms of the CSP, which is what we're talking about, I believe, in this hearing.
Yes, cost of
The
living.
three things that the things that I think are in it from my perspective, the provision of 15 hours of 2 to 3 nursery care, I think will go some way towards addressing need, because that's real money. It's worth up to £6,127, so I've got the correct figure in my head now, for every family with a 2 to 3 year old, and which I think is real support. I think the school meals is a very important thing for families. They are free if you are on Jersey Premium. I would love to have extended that to everybody, but financially that's I think that's very, very difficult to do. However, they are also subsidised, so a hot meal is more affordable than it would have been, and I think that makes a difference in terms of feeding our children in schools, so I think that's a good thing to do. In terms of the wider government plan, there's a huge debate there to be had. We could spend 2 hours talking about whether we're addressing child poverty enough as an island, you know my political views on that. I don't think we're going to really address child poverty until we change our tax system and have more equity on who pays and what we can spend.
What would that look like?
Well, it would mean, for example, having one type of tax system. I'll refer you to my manifesto. It's been in there for many, many years.
About the school meals,
Excuse me, in terms of targeting the school meals, and again, the other minister will be familiar with this, we understand that it's targeted, the free school meals are targeted at pupil premium, which is income support families, plus those who haven't been here for 5 years but would otherwise be eligible. And my panel are certainly aware that there may be families that fall outside of this but are still in great need.
Yeah.
Could you have a look at that targeting with the funds that would be available?
I think, yes, we would always want to do that. If you make them universal, obviously they're not targeted, they're universal. I think that is a decision to be made for future governments as to whether we want to do that. I personally would support that, but that's for future governments. In terms of other targeting, the budget is spent on what we're doing now. The meals themselves are subsidised. They are £2.50, which I don't know if you can put a packed lunch together for £2.50 anymore. Packed lunches were the bane of my life when my children were at school. And so I do have to declare an interest that I'm absolutely biased against packed lunches. And if you just send them and say that food is there. And I think, yeah, I mean, we would want to do as much as we possibly can. And I understand there's that next sort of group of people who are not being affected by that. I think, yes, there is always more we can do. But at the moment, we are trying to make sure that those school meals are absolutely ingrained in what we're doing into the future.
And we understand that parents can make a request and there's a discretion for head teachers. I'm not sure the public know that, so I wanted to mention it.
But I don't want to put that pressure on head teachers alone. I mean, they do, and I think head teachers do a fantastic job when it comes to that.
Can I one final? And if you were going to slightly extend that targeting, where would you target it at?
I think perhaps there are other things that can be claimed in social security, which you're the expert on and I'm not, and perhaps targeting around those areas would be one thing to do.
I can add to this as well, because we had a conversation just last week around the elements in the budget around the back to school bonus and how that's being implemented in a way to encourage families that may not have put the application for pupil premium in, which then leads to obviously the school getting benefits, but also school meals, as Rob has just said, ensuring that people know that they can and that they are getting what they are eligible for is a real key component. Obviously, we've had the conversation across the table before around the back to school bonus as well, but also the higher minimum wage and helping families that are struggling.
I'll hand it to Deputy Miles because of the time. I mind that.
Just one really tiny point. There is absolutely no stigma attached to applying for pupil premium. And I want to say publicly, please do make sure you apply.
Yeah, no, it's important. Thank you.
I've just got some follow-up questions about the CSP kind of in its entirety. So scope is narrowed to 12 core priorities. The 13th was added, the carbon neutrality. Do you think narrowing the focus to a limited set of priorities has worked?
I think there's a reality to that in that there is a 1 year until the election. If you want to get anything done, you're going to have to narrow your priorities. Otherwise, you end up making generic statements that you can't actually succeed in. And there's also a lot of things that are business as usual that if you put into a CSP, they're going to get done anyway. So you have to challenge yourself as a government. So I don't think it has. I think there could always be more, but I think these things will be different at the beginning of a 4-year term than at the end of a 4-year term in terms of getting things done.
Thank you. Does the Social Security Minister want to add anything to that?
Yeah, I think what was important for me when we developed the CSP is being very outcomes focused. You will know, again, I'd brought an amendment to the previous CSP to then have a direct link into the island outcome indicators as well, which have been improved. Before I came into this hearing, I did actually have a look to see where we're tracking, and it's difficult because obviously we don't have all of the latest data. One thing that I'm pleased of that we do have achieved as part of the increase in the minimum wage is that we now have seen real wages increasing at a higher level than the cost of the cost of living. So that does mean that people are better off because of that increase in wages. So, but obviously I'm keen to see outcomes-based accountability, and I'm pleased that this CSP was based on that.
I could also add, for example, I'll give a tangible example of that, the Learn and Grow development of 2-year-olds Island outcome indicator. We are seeing a slight increase in those 2-year-olds reaching their developmental stages. And I think some of the work we've done with pilot schemes for 2 to 3-year-olds targeting those who perhaps need the most support is showing some real fruition now. And I don't want that to end, and I want that to continue. So that's a really good indicator. We need to keep going. I mean, I know there are indicators and any stats as a stat, but I think that's important.
In terms of the current budget, both as ministers, obviously you've had to operate around the Council of Ministers table. I can imagine that the discussions have probably been frank and forthright about proportion of budget compared to perhaps the other priority, the big one of health. So looking at the current budget and what you've achieved, what would you ideally have liked to see in there that isn't included?
I think we would therefore be changing the priorities. I'm pleased that the money for 2 to 3-year-olds is there. I believe that was accepted around Council of Ministers because of the importance, the tangible effect we can have for families with 2 to 3-year-olds, and I think that's very good. What else would I like to have seen? I think these are things that are deliverables, and so you've asked me to replan the CSP and the CSP hearing. I don't think I can do that.
Okay, thank you. Is there anything that you'd like to add, Minister?
I was pleased that we've got some practical things in this budget. I'm conscious that I've got a short time available to deliver. So I'm pleased with where we've got to. Obviously, we all have our own manifestos. We'd all like to see our manifestos funded. That's where you'd start when you're looking at, if it was my budget and my budget alone, you'd look at your own manifesto commitments and committing to that. But I think considering that we came in mid-term into government, I had an 18-month plan which was ensured was a deliverable plan to make sure that we could focus on achieving things. So, we've got things like the whistleblowing legislation currently being worked on, and that will be delivered towards the end of the term. I am keen to see the work that's being done on minimum income standards being completed, so that then we have a better ability to look at what those key critical issues that are facing people affordability-wise are. And I think then that puts us in a really good position for the people planning the next common strategic policy to be well informed in relation to social benefits, for example.
Thank you.
Thank you. And Deputy Tadia, about the risks.
Thank you, Chair. Are the allocations to your department, Minister, informed by the Community Risk Register, and are you aware of any key risks in your relevant area? If I could direct that to the Education Minister first. Thank you.
Are you referring to the CSP deliverables? The risk to the CSP deliverables? Because the biggest risk obviously would be that the money isn't allocated in the government plan through the debate. That would be a risk. If we don't allocate the money that's put there for nurseries, then it's going to be difficult to deliver that funding when the money isn't there, for example. The other risks around, I suppose, similar to the school meals. There are always risks to delivery of any project, which is tangible delivery of a project. And in terms of lifelong learning, it's a very difficult one because there are so many things going on. But the risks to delivery there, I suppose, are in the area of making sure that we're directing the training and directing the need in the right place. But Skills Jersey have done an enormous amount of work on that, and I think we're in a better place. We've been in a good place for some time, I believe, because they know the skills that we need, so there are less risks there. The biggest risks, I think, are just simply that money isn't allocated as we need to, that we've identified in its use. If that's answering your question, Deputy, probably isn't, I don't know.
I think the real risk, I suppose the real question for us is that the risk of the budget not being passed is fairly negligible. But so if we proceed on the basis that the monies that have been sought or allocated, are there, can we talk about maybe the vocational training and the skills upgrading? You're obviously relying on other partners, both within government and outside of government, to deliver some of these key strategic priorities.
Yeah.
Could you talk to us about the risks of it falling down at any one of those points?
Yeah, of course. Whenever we deliver training and education on this island, there are two main risks. One is staffing the training itself. Staffing is always going to be difficult for an island, and that skills delivery is always going to be difficult. So that's one of the areas of risk. But I think with the partners that we have, Highlands College being a really big one of those partners, I think we have a good relationship there, and we're very clear as to what's happening in the future and what can and cannot be delivered. The other risk, I suppose, to delivery is getting companies and businesses on side to deliver, to enable that training to happen. And I think at the moment we're in a position where businesses do understand the importance of training and development. But obviously, as pressures push on those, that's one of the first things that can go. And I would try to urge them to not drop your training, because you've got to think long term. If we get our people trained and we get our people in place for this island, it means that we can deliver those things going into the future.
Yeah, there is a supplementary from Deputy Curtis.
I'm curious, Minister, because you've mentioned that the key risk in particular to this hearing, which is a CSP, is allocation of funding. And you've highlighted that one of the wins that you think is the right priority is funding, for example, in 2 to 3 year olds. But a key area that your fellow minister has been questioned on is the Social Security Fund and the Reserve Fund in particular and allocations. And the tension that there is clearly a reduction in funding the Social Security Fund to deliver funding of other things, and in particular, one of them would be CSP commitments. And I wondered, as a member of Council of Ministers, sitting around the table making that decision, there's been talk of, the risk that there is in lowering the fund there versus your risks delivering the CSP, how you've balanced and how your voice has been heard around the Council of Ministers in making this prioritised judgment in part to fund CSP now versus reductions. And this is one for the
I'll make a point, because I know the Social Security Minister has actually made this point numerous times, but I'll make a similar point from my view. If it was said to me, okay, so how are you going to fund this? We have a number of ways to fund this. One way is to reduce, not to remove, but reduce the amount of money going into an incredibly healthy fund this year, which will have a direct impact for families on this island. How would I have agreed that money if it was being spent on something else? I don't know, a project that I didn't agree with, perhaps not. Because, if we're going to not put that extra money in, and I think the discussion around that needs to understand that a significant amount of money is still going into the Social Security Fund, and it is an incredibly healthy position. We can allocate this money from government to make tangible change in the next 1, 2, 3 years, and it not end that fund in the way that some people are perhaps suggesting. Is that a good use of that money? The answer is yes, because it's a tangible use of it. It means we can get on with doing something now, and there will be benefits longer term.
Okay, but just to be clear, that risk balance that you see in reducing that funding is in two parts. One, because you believe it is a tangible delivery of aims that you want to see delivered that are prudent, but crucially that the reduction in fund, from your perspective as judging part of the approving kind of body of the budget to the Assembly, it's not a risk. It sounds like you feel there isn't much of a risk in reducing the funding because it's very healthy in your view, and the balance is fine.
There is always a risk when you move money in government. There will always be a risk. The level of that risk needs to be considered. That is an incredibly healthy fund. And I think, remember, you're just not putting that additional money in. There is still money going into that fund. So I think if you're calling, risk is fine as a word, yes, I think that is a risk that is worth taking on that proportionally small amount of money for that fund to make a proportionally large impact for people on this island, families, young children, and the other things that are being funded through the use of that money. So I think that is a sensible use of that money longer term.
Okay.
Can I just answer that as well about in relation to my assessments when looking at, because actually one of the things that I did want to ensure is that we were dealing with things that were on the corporate risk register. So when I was being asked for money from other ministers, and this was the proposed solution was putting a smaller grant into the Social Security Fund, one of the things that I did think about was what the risks were on that corporate risk register. And that's why we see things in there that's being funded, such as funding for the emergency services, funding for children's residential care facilities, but also funding for things like digital health. We know that our IT systems run a big risk currently. We currently have our large programme ongoing, our Transform programme, which is around resolving a key risk within my department, which has been properly escalated by my chief officer onto the corporate risk register. So your questioning is absolutely right. We absolutely needed to focus on what the corporate risks were to ensure that we had money going into the right places to ensure that we could reduce or mitigate the risk involved with those.
It's really helpful, but I would like to challenge. Obviously, the investment in digital health, it's one-off investment. Saying this, that the health minister said that the extra funding that health received would go towards aging population and day-to-day spending that are not going to disappear after 4 years. As an education and lifelong learning minister said, this money used for 2-3-year-old, which also will not be disappeared in 4 years. We know that this investment would continue. Now, there is 2 different versions, and I would like to see what's happening. One, it's one-off investment that might be relevant, which is on corporate, and one is ongoing spending that currently allocations came from the Social Security Fund. How you would suggest to fund these items beyond 4 years, not continue to withhold funds from the Social Security funds?
Sorry.
I'm asking about sustainability. This is the 2 different approaches which are 2 different outcomes.
So one of the biggest risks to the Social Security Fund is that we don't have a working age population on the island paying into the Social Security Fund. So for me, this is one of the things that we need to balance. And also we need to, and we had this discussion with my panel just last week about intergenerational fairness as well, and ensuring that we are thinking about the future generations in addition to current pensioners. I can't reiterate enough, current pensioners have nothing to fear from the proposals in this budget. But what we do need to do is ensure that we are planning in the best way possible for future generations. That's why I've also asked for an additional review from the actuaries related to the Social Security Fund, so that, again, this is putting the next government in a good place to be making longer term decisions. It's important that we have factual information before making any longer term decisions. But again, things like the extension in nursery and childcare provision is really important in terms of ensuring that we do have a working age population on our island.
I completely agree. I don't think that anyone around this table disagree with investment in the nurseries and work to subsidize 2 to 3. The question is, this needs to continue beyond 4 years, and where the funding would come beyond 4 years, or it still needs to be rely on the Social Security funds.
Can I add some to
can I just
reflect
say,
on this?
though,
So that in terms of the fund itself, the health insurance fund, for example, is going to be empty in 10 years if the current spending continues. I'm not sure about the other funds, but that's 2.5 political terms. And I think what we'd like to understand is what direction do you think it needs to go in to actually tackle that and prevent those funds being
If you're asking me to
emptied?
make policy for future governments, which is what you seem to be doing, our policies were really clear in our manifesto in terms of ways to raise money for the Social Security Fund, for example. There are caps on the Social Security Fund that we've brought to the Assembly 4 or 5 times and haven't been voted for, that would be raising money for the Social Security Fund to top that up if need be, or we could use those funds in other directed areas. We have a different tax system for some than others, and perhaps that needs to be addressed. Within education, one of the things I would say is that as our numbers drop in education, it may not be a situation where we need additional funding. We just need to keep the money that's there now so that we can use it more effectively with smaller numbers of children coming through. So there are ways in which we can fund into the future, but making policy in 4 years, I don't know. I mean, that's very, very difficult because it's a difficult economic. We don't know what the economic situation will be then. We don't know what hue of government we'd have.
Can I clarify? So I am talking about this political term, and thank you for clarifying about some of those policies. And you mentioned raising the caps and reforming the taxation system. And you're both in the same party, I think.
Yeah.
You know, let's state
But these
that.
are political questions are being asked now.
Yeah.
That's fine. I can answer them politically as long as they're recognised as political questions into the future.
But are those
We've gone way off the CSP now. But
Are
that's
those
okay.
policies, in terms of achieving what's in the CSP now and into the future, are those policies, are other ministers becoming more receptive to those? Do you feel that there is a shift in terms of those being accepted?
I don't think that I can answer about the political. I don't think I can answer as to where Overton's window is going to be situated for future governments. I think that's way beyond the CSP hearing. I know where I'd like it to be
No,
shifted,
it's not about
obviously.
the CSP. When we have a decision, you have 13 priorities, and to achieve this priority within the CSP, the only way to achieve the priority is to reduce fund to the Social Security Fund, not through the raised incomes, not through the making changes within the current budget. It was currently, this is the only way to achieve CSP priority. So it's not about political question or not political question, it's the facts. So the
Well,
question.
I'm sorry, I have to continue. You asked me an overtly political question. What do I think they've shifted towards my party's line of thinking?
I didn't ask about
Well,
the
that
line of
seems to be where
thinking.
it came
Okay,
from.
let's get to your part, right, to the Deputy Tadia.
I mean,
Yeah.
I hope so.
In a similar line, I mean, a question we did ask the previous minister, who's obviously not a party member, I don't think, and something that he gave was an interesting answer, was that he said that the people in Jersey seem to expect better public services. So he was talking about healthcare, but also that we're working within the constraints of a headline tax rate of 20%. So I suppose moving past this CSP, and I know strictly we're only here to ask about it, but are there risks if we continue to fund the Social Security Fund or continue to not put money in? It might be affordable in the short term, but at what point do you think future governments need to make some strategic decisions about tax and spending, I suppose, is the question being asked, perhaps?
I can answer that in relation to the advice that we received from the actuary and the actuarial review, which is very much around giving the future assembly, because let's face it, it won't just be the future government, it will be the future assembly voting on things, the advice or the information that they need to make decisions in relation to the state's grant on an ongoing basis. We did commit to these priorities and making these priorities happen. We are, and we're as a Council of Ministers, working within the parameters of where we are with the Assembly and other decisions that the Assembly have made this term of office. And Rob mentioned some of the propositions that have been put forward to the Assembly around changes in taxation and contributions that didn't go through. So this is very much us dealing with the revenue that we have coming in as approved by the Assembly. Again, the CSP was approved by the Assembly, and it was quite clear what those commitments were when the Assembly approved the CSP as well. So we have to work within those parameters. Yes, we're a Council of Ministers, but we also are there to implement the decisions of the Assembly.
Thank you very much. And we'll move to the GP fees, and I'm handing to Deputy Tadia back.
Thank you, Chair. So turning to Minister for Social Security, the Common Strategic Policy commits to reducing GP fees. What specific funding or policy measures in the proposed budget support this commitment?
The reduction of GP fees was achieved in the actually pretty much as soon as we entered into office. So we increased the subsidy available 2 GPs for visits, also for some of the other services as well, so such as telephone consultations. We've also implemented the free GP visits for the full-time students as well, and of course we have the free GPs for children. So that was already implemented. It's not a matter for this particular budget. We've discussed the HIF, Deputy Dublé mentioned, and we have discussed that in my scrutiny panel as well, the work that I'm supporting the Health Minister on to look at health funding holistically, because of course what the money that we put into primary care and encouraging people to seek early intervention and resolve matters as soon as possible then leads to savings in secondary care. So this is very much continuing across government piece of work. What I will say is the way that our current agreement with GPs exists means that GPs then charge their own co-payments on top of that. It's really important that people know that information about GP charges is available on the government website so that they can make decisions around who they're going to choose as their GP and be fully aware of what additional costs GPs may be charging. I'm just trying to think if there was any elements of your question I may have missed there.
No, I think that seems like. So, are you saying that there's no addition? This period won't be unrolling any new reductions in terms of GPs visits?
Not at this point in time. Where I am focusing is the additional money to extend Pension Plus to pensioners, to more pensioners, because I was concerned that there is quite a hard cut-off between those pensioners that get access to other benefits and those that don't. So this is about smoothing that cut-off out. What that will also do is enable those pensioners that become eligible for Pension Plus to also access the Health Access Scheme, which will lead to cheaper GP fees for them. So that's where my focus is within this particular budget.
Do ministers have any concerns about the fact that a GP visit can vary in terms of its length or in terms of the interaction you have with the patient and GPs? So, one might last 5 minutes and be charged the same amount as a more complex meeting that takes place for 25, 30 minutes. Are there any concerns about ensuring value for money for patients and for government in this?
Yes, I'm always concerned about ensuring for value for money. At the moment, we've got the agreement with the GPs that we've got. That's something that I can't be changing in this term of office. We also have an active live piece of work going on with pharmacy at the moment to try and improve what we have in regard to what pharmacy services can be done. We did the work regarding nurse prescribers as well. So there's all sorts of facets of work to ensure that the services available to people outside of the hospital are at the very best level that they can be. I can see Sue wants to add something.
In terms of the quality of patient experience, there's a different payment that goes to doctors, which is called the Jersey Quality Improvement Framework. The cash going into that is also increasing over the last few years. So that's a very outcome-based measurement whereby you set targets, the clinical targets set each year for what doctors should do in terms of their patients, and they'll get points for hitting those targets. And there's cash associated with various points. So that's an ongoing, and each year those targets get harder to achieve. So we're pushing the doctors to improve their clinical outcomes year after year after year.
And who assesses those targets?
The targets are set by a clinical panel with the government, with the minister taking final responsibility, and then they're assessed through the computer system that runs the clinical information that sits behind medical practice in the first place.
Thank you. Minister, can I ask about the proposed budget? So that £59 million in health benefits from the Health Insurance Fund. How much of this is allocated to subsidising GPs' fees, and to what extent is that level of funding sustainable and sufficient in the long term?
off the top of my head, I'd need to get back to you in writing on that, because off the top of my head, I wouldn't have that information.
It's not, was because it's not in the budget.
Yeah, it's not the HIF funding going out to GPs isn't part of this particular budget process. I have obviously engaged with my scrutiny panel about the HIF itself, and also the work that I'm doing with the Health Minister, that the Health Minister's leading, around the whole health system and sustainable funding into the future for health. So it all does need to be seen in the round like that.
Thank you.
I'm happy to pass on, Chair.
Yeah, thank you to Deputy Double, please.
Thank you. So you've mentioned some targeting of free GP appointments to children, for example. How can you further target those free GP visits or reduce fees for any other groups? Is that something that can be achieved within the current budget as it's proposed?
I think, like I said, the targeting of the health access scheme to further pensioners is something that is a priority for me in this term of office. We haven't got a lot of time left to be implementing new schemes. Last year, we focused on implementing the free leg wound dressings, which was the result of a successful states proposition, and I was pleased to expedite that work and get that done, because I know that makes a real difference, day-to-day difference to people. So I am focused on what I can achieve and what I can deliver. And everything that we do, of course, needs to also be negotiated with the service providers. So it's not necessarily a quick fix.
And when the funding is being targeted in terms of reducing the GP fees, how do you evaluate whether that funding is being targeted effectively so that you know whether to make any changes?
I think that as well comes back looking at what the outcomes are.
Is that the quality improvement framework that was mentioned?
So that's different.
Something different, okay.
And we've got that in relation to GPs and pharmacies as well. There's some quality work going on there.
I think we might need to get this bit in writing as a follow-up.
Yeah, we'll tell you to writing,
But
yeah.
can I just ask a final one? Minister, do you believe that a different model should be considered for funding primary care that may include capping fees?
Oh, my manifesto position on healthcare being free at the point of need is quite clear. I've obviously gone as far as I can possibly do, given the parameters that have been set by the Assembly and the budgets available, but my manifesto position hasn't changed, and I'll continue working towards that.
Can I just say as well, I think the free GP fees for children is really important, and I think it has another impact, which is about giving reassurance to parents, because, you know, if you're struggling, your child's ill and you're not sure, making that choice as to whether to go to GP or not is not something we should have to make for our children, and you don't have to now, and that's good.
I think it's good. It's going back to the GP fees, and I'm moving towards the aging population. Would you give a bit more details, because aging population is part of the common strategic policy as a whole, and also GPs are part of the common strategic policy. What are pensioners can expect through this work that you are doing to smoothen the hard cut?
So obviously I haven't got the budget approved as yet. That comes in, and what we will then do is be able to finalise the details. I'm just thinking off the top of my head, and correct me if I'm wrong, I think it was about 1,000 pensioners that we were hoping to be able to bring into the new eligibility for Pension Plus. So the outcome will be that 1,000 pensioners will get access to the Pension Plus benefit. They will also then get the access through HAS to the cheaper GPs as well.
Okay.
Through that.
Are you
That's the
aware
outcome that I'm
if
working on at
any
the moment.
modelling? No, thank you. Are you aware if any modelling is underway or has been done to assess the fiscal pressures arising from the demographic change, including obviously impact on the aging population of on public finance.
There's lots of work happening across government with regard to the ageing population, and of course we've got cross-government ministerial groups that work on
Which
things like-
ministerial groups are looking around the ageing population?
So around the ageing population, we have the HAWAG Plus group, which looks at population and the demographic changes that are happening to population and what the risks are around that. With regard to cost of living, I also sit on the cost of living ministerial group as well. That's the ministerial group that's commissioning, well, via the Minister for Sustainable Economic Development, the work on minimum income standards as well. I was pleased when we, because we thought that we'd only be able to afford with the money that we've got to do 2 different types of households, but it's actually came out when we procured that piece of work that we can do multiple different types of households, so that information will be far richer than what I originally thought we'd get, which is a good thing.
And one thing, we will make preparation, it's from Common Strategic Policy, I'm reading it out. We will make preparations for our projected demographic changes, including our aging population, falling birth rate and rising level of disability to ensure sustainability of our health provision. This would require understanding implication of the cost of the aging population. Have you seen any data that can show how much it will cost or cost now and it will cost in the future?
I've seen multiple different reports and multiple different presentations all around that theme, because that's a theme that has a strand across the whole of government. I know Sue is doing an awful lot of work in relation to population.
Have you seen the data how much unpaid care cost?
I haven't seen that specific piece of data to my recollection. No.
Is it any data exist that can present unpaid care cost and how much how much islanders who care for their people will add into the economy, and how much it will require from the social security and others to support if it will not be in place?
I'm sure I can ask Statistics Jersey what they have. Sue, do you want to?
So you, by definition, you can't count something which is unpaid and sits outside government systems. What you can do is we could give you information from the long-term care scheme. So long-term care scheme is set up to support people being cared for at home, as well as in care homes. And within individual budgets of each individual person, there will be an allowance for the amount of support that's being provided by the family and the amount that's being provided through paid carers. So our system was already supporting informal carers through that combination of matching up what the family would like to do themselves with what needs to be brought in from outside. And the long-term care also allows for respite budgets to be allocated and saved up for create respite breaks during the year as well as on a weekly basis.
Can I just check so I can follow up in writing though? Is the panel asking for care in relation to all care? So we're talking about parental responsibility as well.
We will put it in writing questions.
Yeah.
So we'll
I
put
think
questions
it's
in
important.
writing and we'll clarify there. I think it's important.
Care takes a lot of different.
Yeah.
Yeah.
Absolutely. We'll get back to with written questions.
Can I ask a clarification? Minister, you mentioned that with your additional funding, you could fund an additional 1,000 pensioners for the Pension Plus. How many are currently receiving it?
I'm not sure that number's right. It's
Something else is £1,000. There's another 1,000.
Yes, it will be the people with £1,000 tax liability.
So do you know the current numbers of who is receiving it and the numbers of who will receive it after the new funding?
Let's do this. Let's go out these questions and we'll follow up with written questions.
Or
for them.
if you can find it before the end of the hearing, that would be helpful.
Okay.
Yeah.
And my apologies if I got my.
No worries. No. It's fine. We'll follow it up. If you
We'll
find
make
the
sure we
numbers
get you
before end of
correct.
the hearing, great. If not, we'll follow up with written
But
questions.
as I said to the to my panel just last week, these projects are very much they'll be scoped following the budget being approved. What I don't want to do is waste a lot of officer time scoping up something that then isn't going to be implemented because there isn't the will of the Assembly to provide the budget.
Okay.
I'm going to ask questions to the Education Minister, but just quickly, a question to Social Security Minister. You mentioned about the ministerial groups working on including work on the ageing population. We heard earlier about one called the Determinants of Health group, which will include Social Security Minister. Will this also be looking at the ageing population?
I'm sure it will be. I think that's one of the health ministers' groups that's being set up. I work closely with the health minister. We've got lots of things that we do need to work together on because my responsibilities coincide with some of his. It's important that we have systems that operate and work together. We will, of course, we're very, very cognizant of the impact of the ageing population on future health spends. I had a presentation myself, the Treasury Minister and the Health Minister had a presentation just a couple of weeks ago, and that was very much one of the topics, and that's really why we know that the piece of work being undertaken about the full cost of healthcare across primary and secondary healthcare is so important.
Well, thank you. Minister, how is your department working to ensure that early years funding supports parents, particularly those on low incomes, to return to work or access training? And for parents receiving income support, how would this impact their benefits if they took up part-time work? So this is sort of to both ministers, actually, this one.
Yeah, the 15, well, in terms of focusing on the CSP, the 15 hours for 2 to 3 year olds, I think will have an impact for those wanting to return to work in a number of different ways. One might be, it might be parents who will say, I can actually return to work part-time because I have childcare that I can afford. I think too many parents on the island go back to work only using their wages to pay for childcare. That's a reality, I think, for many families. And so I think it can encourage people to get back into workplace for that way. So that's one way in which we can do that. The other thing is that those parents who can access this money, who are already paying for childcare, may continue working in the jobs that they're in rather than stopping working because of the cost of that childcare. Because there comes a balance point. I know I had it when we had young children where is it worth you both going out to work or is it worth one of you staying at home? With that support for childcare, I think we can keep people in the workforce. I also know that as Education Minister, the majority, there is a majority of women who work in education. Women who are having children, if they want to come back for 2 days a week, for example, initially with that childcare available to them and come back part-time, we certainly want to be flexible to enable that to happen within one sector.
Okay, thank you. But will that impact on people's benefits if they're getting income support already? How will that be balanced?
Because of the earnings disregard, people are always better off when they are working rather than not working. So this is a positive thing if more parents can take jobs and afford childcare. We obviously have our childcare components of income support. In fact, Rob and I were talking on the way here about the work that we need to do across departmentally to ensure that people get the best outcome possible. But I do want to reiterate that because of the disregards and income support, people will be better off for working.
Sorry, I put my hand up. Can I just clarify that the money that goes towards to pay for nursery fees will not affect income support? If somebody goes back to work and earns, that's a separate thing of their earnings and income support. But parents are not going to lose out because they're having nursery fees paid. That's a very separate thing. I think it's really important parents get that message. That's not what that's about. It's not going to be seen as an income for them because it's paying for nursery care. So that's a really important point. So thank you for raising that and let me make that point.
So has any consultation been carried out with the business community to see whether there is part-time work available that people might want to use?
I've been focused on the delivery of the nursery hours, to be quite frank, and I suppose.
So that's no then. How is your department working? So
It's for the social security.
yes, this one is for the Social Security Minister. How is your department working with the Minister for Education and Lifelong Learning, employers and training providers to ensure that early years funding and childcare access supports parents to work or upskill?
Obviously, we're in initial stages of conversations. We had a discussion just the other day with both myself and Rob and officers around possible implementation of the early years. I am very keen, as I hope the panel are aware, to work collaboratively. I think it's really important that ministers and departments work together to ensure that there aren't unintended consequences because there's a lack of communication. So I think what I can give my commitment to is that we will continue to have that collaborative work. Obviously, my department, through the back to work area, will also provide the additional support to people who are looking for jobs. They have the connections with employers as well, and the Jobs in Jersey side of things.
Minister, if you mentioned already back to work, have assessment been done or have any initial engagement was done with the businesses that will be able to provide a position, employment options for between 12 to 15 hours if somebody would like to go back to work? Because it's kind of 12 hours probably with pick up. And the other part of the question, if back to work would have a design program training for parents who've been out of work for a long time and they need different skills to go back to work, because they would have an opportunity, as we have now options for the funding.
I think it's important to remember that whilst there might be the hours, the 3 hours, that doesn't prohibit people from working more hours as well. But also we do have the income support components that support kind of wraparound care as well. So we do need to check across the system how things, it might actually help, I think, if we do some kind of case studies around how this might work practically, and then we can present that through.
I mean, you have two months, hopefully the budget will be approved and you would have 2 months before this would be implemented. Would the public, parents would know what they can, to have a clarity, the collaborate 15 work hours, it's clear from the education perspective, we are going back to the social security, what they can receive, which support, which training, how to interact with all wraparound as it will be presented.
Shall I just clarify? So for those under 3, for children, parents of children under 3, there's not actually an obligation at that stage that you must look for work. But absolutely our back to work team are very focused on ensuring we can give the best possible support, and actually we do have really targeted training specifically for parents returning to work. We run workshops, and actually sometimes by bringing those together in groups, we find that actually connecting with other parents who are also making that step back into work, who've maybe had a few years out, it can be really powerful. And as part of that, we often bring in employers. We do find that we've got some, there's many employers who absolutely recognise that the flexibility around, working hours in certain industries in particular, we've worked quite closely with employers. So I think having that tailored support, and everyone who wants to be, who is looking for a job can have a tailored one-to-one advisor, but actually the group training that's sort of really focusing on, often it's a lot around confidence building and things like that, going back after that gap is something that back to work is really focused on.
I'm wondering about the time. Would it be okay to have extra 10 minutes? We have 2 more areas that we will finish within 10 minutes.
Can I
Yes,
just,
but
can
I do have a drop-in starting at 12:30.
Okay, so 5 minutes. Yeah, just in this case, let's get on with the questions.
I was
Okay,
make a
sorry.
point about that, but it's okay. Yeah.
Can I ask the Education Minister, around the 15 hours for the 2 to 3-year-olds, is that primarily to address the affordability of childcare, or does it address other aims such as the accessibility and the quality?
Yeah, I wouldn't. I would say that all of those 3 go hand in hand. It's about quality of childcare as much as anything else. It's about accessibility, and it is about financially helping families, because it is a huge expense. It's really difficult to prioritise any one of those. I will say, however, some of the work we've done with some of the groups and our pilots have shown that intervention early on, particularly where there are additional needs, is really, really paying for itself in terms of those children, for example, simply being ready for school. And if you catch up that early, the benefit later on is just really difficult to measure, to be quite frank, because it's enormous.
Thank you. And given the struggles with recruitment that the sector is facing, what support is being given to providers to enhance the quality of provision?
Yeah, well, we're going through the second. I mean, I do feel that perhaps you should say something there here, Jonathan. Do you want to just address that point about training?
We have literally 10 minutes. Apologies.
We are trying to go through the second phase of the training programme and recruitment training, CPD and workforce plan. That's been, for example, this is the first time we've included childminders, which I think is a step forward because it gives choice. And we've had some excellent discussions with childminders about what is it you need, how would you access that. And I think those are positive discussions that I've certainly learned from, we've learned from, to get this right well into the future and make it, that word sustainable that you've used, into the future. It's always going to be a challenge. I will say, however, that when we did the pilots, our recruitment was very, very strong. There were lots of people who want to be involved in those.
You mentioned challenges. What are the main challenges?
The challenges are going to be that, to be quite frank, childcare and looking after children early years has not been something we valued enough as a job in our society. You know, I don't know if I'm pushing an open door when I say it's no coincidence that it's vast majority of women in those posts, and perhaps it's just part of the reflection of the way our society sees those jobs, and it shouldn't be the case. So we have a piece of work to do there to say, and I'll use this opportunity to say publicly, it's a really valuable area of our workforce that makes a massive difference for children, families, and the future of this island. So I would encourage people to get involved. And it also requires skills. You need to have those skills. So it's a very skilled and valued part of our workforce.
Thank you. And is there a longer term plan that you're kind of on track and working towards that includes fulfilling the Policy Development Board recommendations?
Yeah, there was a lot of recommendations there, but I think this goes a long way towards meeting some of those. Is there something specific I missed, Jonathan? Because I know
is your long term ambition still to have a transformation fund to enable graduate workforce in the private setting?
Yeah, in the long term, I think that would be a very good thing to do, but that is a long-term commitment. We've got to balance that really carefully, because we want to make sure that our training is a graduated level of provision, so that we can staff. And it does. We don't want this to be counterintuitive, so we end up without a workforce. That is not going to work for us. But I think, again, this is value in the profession, isn't it? If you see that profession and say, actually, you know, this could be a graduate profession into the future, that's a good thing, I think, in the future.
And I have one more. In terms of child development, so obviously 15 hours is the starting point for this universal offer. What's your view on what is best for child development in terms of, are we working towards a 20 hours a week offering, or would it be more?
Well, this is always a really interesting discussion. I think that we need to work towards, and this is about funding, sustainable funding in the future, and I think it will be something that should be part of our debates in the coming years over elections, for example, is if we want to invest in our children and give those extra hours for families so that they can return to the workforce, so that children can socialise in the way we want to with high quality childcare, we're going to have to pay for it. I personally, we stuck on 15 hours for 38 weeks a year. I always get that wrong, that's why I checked, because we got the money for it.
Mm-hmm. Okay, thank you.
So.
Yes, so we still have a lot of questions, but while we've got you both here, this one is a good one. So will you commit to recommendation 13 of the Nason Review and extend educational provision up to 25 years of age for people with special educational needs, ensuring that the transition from child to adult learning is part of a Jersey-wide plan for lifelong learning and support?
Do you want to talk about the transition work that's going on? Because I know that, yep.
So obviously there's a key priority within the disability and inclusion space and within the work that my team do around the transitions into adulthood for people with learning disabilities. We've got 4 ministers involved in that piece of work. So that's myself, Rob, the Minister for Health and the Minister for Children. also the relevant departments. Again, it's really important that this is a collaborative piece of work, that we also hear from the Disability and Inclusion Advisory Group. So that is one of the key priorities that my disability and inclusion team are working on collaboratively with the relevant departments.
Yeah, and I think as well that the work that will go on following the SEND review as to how we deal with all of those areas around not just record of need, but whatever a record of need becomes, because it's changing elsewhere. We have, therefore, for young people as they go through their education system, good evidence of their needs. Why we don't extend that to 25 to enable them into the support in the workplace, I really have never understood. So yes, I would like to see that happen. Can we guarantee that will happen before the next election? I can't make that guarantee right now, but it's certainly something I think should go into now and beyond, because it makes sense. It's a simple way to do it. And I actually think it will make the process for Social Security and all of the organisations that support people up to 25 a lot easier. The example is what's happened with care leavers up to 25. That has got a very structured process in place. I'm sure there'll be errors somewhere along the line, because there always are, whatever we do. But that's a model I think that we can use for the future.
So you can't say that you both commit to this extra support for people up to 25 with special educational needs, but you think would be a good thing to do?
Well, no, I think we can commit to saying that, yes, that's exactly the type of thing would happen, and a lot is already happening. So, for example, on the extended, so Skills Jersey, for example, when people are at university, if they're working on island, they get support. There is a lot of support in education. I can't really talk about the education part of it, but yes, I would say I would be absolutely committed to that because it's the right thing to do. But we can't promise that's going to happen overnight. I think we need some work to be done on a number of things. But I think as we take on those challenges openly and transparently, which is what we've been doing, that's one of the things I think that is absolutely achievable for us or any government into the future. Yeah.
Okay.
Thank you very much. Any other questions from everyone? No. Thank you very much for extra time, and thank you for your